it's what I presented in Ottawa. There is few tools that are very cool, and now we are validating them into for the clinical practice in physiotherapy. So the first one is it's a quantitative pain mapping software. So it's what you're doing when you're doing a body chart. You know, you have the body of the patient, and the patient is drawing on it. So we numerize this. The patient enter his weight and its age and his sex, and the software is able to create an avatar with a silhouette of the patient, and the patient draw on the avatar, and the software is able to calculate several parameters, the pain surface in square centimeter, and the distance of each pixel that the patient is drawing from where are the pixels to the center of the spine. So we have three main information. We have the surface of pain, we have the topography, the distance between the spine and the pain of the patient, and some information regarding intensity too. And this helps us to develop, so this is a very good tool to assess pain evolution from session to session with patients. So it's an outcome measurement, which is more precise than a simple numerical scale. And the second main advantage, it's what we just developed. The paper is accepted now, and we are waiting for the publication. We validate, it's what I presented in Ottawa. We validate an algorithm that is able to detect centralization and directional preference based on the software with patients with spinal pain. So how it works: the patient draw his pain, we do the repeated movement, then we redraw the pain on the software, and the software is able to say if the patient centralized or not with a confidence interval, so an approximation of the uncertainty. And this help us to, this is very cool to classify patients in an objective way in research. But in clinic, in the next, I think, few years, we will link this software to outcome measurement. And in, I think, 5 to 10 years, I think we would be able to based on the first session, being able to predict the outcome of the 3, 4, 5, 5, 6 session based on the pain variation in the first session. So we are working on this now to better identify patient and predict outcome.